Welcome all back to the channel. Today we'll talk about something we all will face at some point. Yes, it's the pain of the back. It can be a tough and tired pain, whether it's back or back up. Today I have the solution for you in this video. In this video, we will dive into the common causes of back pain, and we will explore some effective treatments for a better feeling, and we will explore how to prevent it and avoid it to get better rest. This video will be comprehensive and rich information that everyone suffers from back pain, so if you know someone who has this pain, you have shared the video with him to use interest. The back pain is one of the reasons why people are forced to seek medical assistance or lose their work. Back pain is one of the main reasons for disability worldwide. Fortunately, some measures can help prevent or mitigate the most back pain stones, especially for under 60 years. If you do not find prevention, simple home treatment and proper treatment can often heal back in a few weeks. It is rarely required back pain to conduct surgery for his treatment. First, we'll talk about the symptoms that come with back pain. The back pain can range between feeling pain in the muscles and feeling of harassment, or burning pain or pain like a stabbing. Pain can also spread down the leg. Curvature, leaning, lifting, standing or walking may lead to a worse increase. When do you have to visit the doctor? Most back pain gradually improve domestic treatment and self-care during a few weeks usually. The doctor consulted in the case of the back pain that it lasts more than a few weeks. It is very intense and does not improve with comfort. Spread in one of the legs or in the legs together, especially if the pain extends down the knee. Causes weakness, numbness, loss of one of the legs or both. He's accompanied by an anonymous weight loss reason. In rare cases, back pain may be a signal to a serious medical problem. Ask urgent care if the pain of the back causes new problems in the intestines or bladder. With fever, afternoon falling on back or exposure to punch in the back or other injury. What's the pain of the back? The back pain often occurs without apparent reason in tests or perceptions. Cases that are commonly associated with the back pain include muscle stress or ligaments. It is possible to cause frequent large or sudden strange movement stress back muscles and spine tie. For people under physical health, constant stress can lead to painful muscle contractions. Swollen or tear the disc. The discs work at the pillow's home between the bones and the spine. The soft material can be swollen within the disc or torn and pressed into nerve. However, it may not cause a bulge or tear the back pain disc. The disease shows the discs in X-ray tests, computerized or magnetic resonance that is conducted for another reason. Arthritis. The skeletal inflammation can affect the lower back. In some cases, arthritis can lead to narrowing the area surrounding the marrow cord, a condition called narrowing the spine. Osteoporosis. Painful fractures can be infected in spine vertebrae if bone becomes toxic and fragile. The midvertebratus, also called inflammation of the axial vertebrae joints. This inflammatory disease can cause some bone merger. This makes the spine less flexible. In some cases, the pain of the back can exacerbate and anyone can get back pain. This includes children and adolescents. The following factors can increase the risk of back pain. Age. The injury of back pain is more commonly raised with age, starting from the age of 30 or 40. Lack of exercise. There may lead to weak and unused muscles in the back and abdomen to the injury of back pain. Overweight. The weight of the excess body causes an additional pressure on the back. Disease infection. Some types of arthritis and cancer can contribute to back pain. Raise things in an incorrect way. Use back instead of legs can lead to back pain. Psychological situations. People exposed to depression and anxiety seem more likely to hurt back pain. Anxiety can cause muscle tension, which may contribute to the injury of back pain. Smoking. The incidence of back pain among smokers is increasing. This may result in smoking causes cough, which may lead to the lack of discomfort. Smoking can also reduce blood flow to the spine and increase the risk of osteoporosis. Because of the spread of back pain, many products that are preventing or mitigating these pain have emerged. However, there is no strong evidence that there is something that can help cure this situation, as some of the shoes fillers, back or cutting furniture with special design. Moreover, there does not seem to be some kind of pillows that fits people with back pain specifically. But it might be about what you feel with them as much rest. How do you measure yourself from the back pain? Improve the physical condition, learn the correct way to deal with the body and train them in the prevention of back pain. To maintain the health of the back and its strength, it is recommended to follow the following. Exercise. Regular aerodynamic activities can influence, such as those that do not threaten the back or suffer violent trauma, increase the strength of the back and its ability to bear and allow the muscles to better perform their functions. Walking, cycling and swimming can also be practiced as useful options. Talk to the doctor about the activities you can try. Build strong and flexible muscles. Help the abdominal muscles and back exercises, which strengthen the body's center, to adapt these muscles so that they work together on back support. Keep healthy weight. No doubt that overweight glowing back muscles. Quit smoking. Smoking increases the risk of lower back pain. The risk is increasing with the increase in the number of cigarettes that smoke per day, so the quit smoking reduces this risk. Avoid movements that cause back or face it. To use the body the right way. Stand right. Don't walk or walk. Keep the pelvic area in moderate position. When standing for long periods, put one foot on a low footrest to reduce the load on the lower back, and instead of feet. The body's quality position can reduce pressure on the muscles of the back. Sit right. Choose a seat with a comfortable back zone pillar, 2 armrests, and a rotary base. A pillow or towel can be put wrapped at the bottom of the back to keep the normal bending of the back. Keep the knees and hips and the body's position from time to time, at least half an hour. Lift the loads right. Avoid lifting heavy things, if possible. If you have to lift a heavy load, depend on your legs in it. Make sure your back is straight without twisting and 2 knees only. Hold the load soon from your body. Find someone who helps you raise pregnancy if he's heavy or you can't lift it. There are some exercises and movements that dilute and throw out back pain and succeed these exercises with all age groups, so try to apply them now. Exercises will often help relieve back pain and measure the feeling of more discomfort. The following exercises work on extending back and support muscles and strengthen it. At first, repeat every exercise a few times. And then march exercise a number of times more when it becomes easier. If you will start to adhere to a program of exercises due to the constant back pain or after exposure to injury in the back, talk with a natural or other healthcare team members about activities that you can safely perform. Exercise the prolongation of the knee to the chest. Lie on your back with your knees bent and keep your feet straight on the ground. A. By using both hands, grab one of your knees and put it to your chest. B. Tighten your abdominal muscles and pay your spine to the ground. And keep this situation for 5 seconds. Promise to the starting position, then repeat it with the other leg. C. Promise to the starting position, then repeat it with both legs at the same time. D. Every movement repeated, lengthening of 2 to 3 times. This arrangement is fully implemented once in the morning and again in the evening if possible. Exercise rectangle down back. Lie on your back with your knees bent and keep your feet straight on the ground. A. Keep your shoulders steady on the floor, then roll your nostalgic knees to one of your side. B. Keep this position for 5 to 10 seconds. Slowly go back to the starting position. C. Repeat these steps for the other side. D. Every movement repeated, lengthening of 2 to 3 times. This routine is fully implemented once in the morning and again in the evening if possible. Exercise improved elastic lower back. Lie on your back with your knees bent and keep your feet straight on the ground. A. Press the abdominal muscles so that the lower back pull up the floor is adjacent. B. Stay like this for 5 seconds and then relax. Just get your back, drag the belly button to the ground. C. Stay like this for 5 seconds and then relax. Then repeat the exercise. Start 5 repetitions a day, and gradually increase the number up to 30 repetitions. 2 bridge position exercises. Lie on your back with your knees bent and keep your feet straight on the ground. A. Keep your shoulders and your head in a relaxed position on the ground. Tighten your abdominal muscles and your iliac. Then raise your hip to make a straight line from your knees to your shoulders. B. Try to stay in this position for a while to take 3 deep breaths. Then return to the position that I started and repeat those steps. Start 5 repetitions a day, and gradually increase the number up to 30 repetitions. Exercise the rectangular in the cat. You warm on your knees and hands. A. Turn your back slowly up, as if you pull your belly towards the ceiling with tilting your head down. B. Then I put your back and slowly down to the ground with your head up. C. Then return to the position that I started. The exercise was repeated from 3 to 5 times every day on 2. Exercise the rectangular turn down back while sitting. Sit on a seat with no support chair or a high bar chair. Put the right leg on the left. The left annex is proven on the outer part of the right knee, and then roll your body and it is tight to the side. A. Keep this situation for 10 seconds. Repeat exercise with the other side. B. This lasagna has repeated from 3 to 5 times per side on 2 periods a day. A shoulder board. Sit on a chair with 2 arms or a high bar chair. A. During your sitting in a straight position, the 2 shoulder board was included together. B. Stay like this for 5 seconds and then relax. The exercise was repeated from 3 to 5 times every day on 2 periods. By understanding the causes of back pain and take steps to treat and prevent it, you can control your health and return to enjoy life without restrictions. If you find this useful video, make sure you love and subscribe to more health and wellness content. And if you have any questions or personal back pain treatments to participate, leave the hang down. Thanks for watching.